Next question, Mr. Peterson. Tell me about the Part D prescription drug coverage changes. There's some rumors out there. There's some buzz out there talking about medication coverages changing for 2025. What can you tell me?
Well, I can tell you it's the biggest changes we've seen in our careers. We talked to agents that have been doing it just a little bit longer than us. It's probably the biggest changes since 2006 when Medicare Part D prescription came out. So we can't go into great detail until after October 1st for a few reasons. One, the government doesn't allow us to. The Medicare asks us not to do that. And I think it's a good decision on their behalf. They don't want to confuse people until the enrollment period comes up. And if they let these telemarketing companies do whatever they want, then it'd be completely confusing. So I think that makes sense. So let me to give you the information we can share. Right now, every prescription drug plan, whether it's attached to your Medicare Advantage plan or a separate standalone prescription drug plan, has something called a maximum out-of-pocket, right? They have a limit to your spend. And it's changed over the years. This year, it's capped at a little over $8,000 that you could potentially spend. Now, I'm going to give you very generalized numbers because it's actually not $8,000, but that's the number that's printed. It could be less than that based on what you spend. But there's all these different, as you can imagine, when the government creates a system, it's very convoluted. But right now, that number is around $8,000. It's proposed, and it looks like it's going to happen for next year, that number will be capped at $2,000 or less. So to have, when we say the biggest changes ever, to go from a potential $8,000 if you're on some expensive drugs to $2,000, and the cost of that difference is going to be absorbed by the insurance companies, going to be absorbed by the government. You can imagine, if you start to kind of extrapolate that, what that's going to do. So there is potential that if you have a standalone prescription drug plan, this is a rumor, that's all this is right now, but they're saying the average standalone prescription drug plan is going to go to over $100 a month. Now, to put that in perspective, right now there's plans out there that are 50 cents a month. There are plans out there that are $30 a month. The average is around $40 a month.
Yeah.
To go from around an average of $40 to over $100 is a massive change. And if you think about being on a fixed income and you don't do your research and don't make a change and don't look at that, to have that kind of increase per person per month. On top of that, there's some things that have been part of the Inflation Reduction Act that the current administration put into effect a few years ago. There is a reduction in what you spend towards certain types of drugs. All of these things are going to go into effect January 1st. Now, again, it's the government, so there's some talk about funneling some money into the system to reduce those premiums down from $100. That hasn't been done yet. There's all kinds of things. But what we can tell you, there's also some, what you're going to hear of an M3P program. And this isn't something I can't talk about. It's out there. It's out there. You're going to hear it called smoothing. I hate that term.
Me too.
Basically, what you can potentially do if you meet the criteria and it's something you want to enroll in and you have to enroll, you can take the cost of your prescriptions and basically finance them over the year. Now, I'm using the word finance. I'm sure the government wouldn't love that term. But basically what you're going to do is you're going to enroll in that program with whatever insurance company you're in. It's not through the government. You'd have to enroll through the current insurance plan that you're on. And you're going to say, let's say you have a drug that's $500 a month cost. Okay, and I'm going to put a caveat really quick. What they're saying is that your yearly cost of drugs need to be over $600 for this to make any sense for you. But let's say you had a drug that's $500 a month. You can now in January get a hold of your insurance company or your insurance broker, your consultant, and say, hey, I want to enroll in the M3P program. And when you do that, what happens now is the insurance company is going to take your yearly cost for that drug and spread it over the year. And you'll be making a payment to the insurance company every month. You cannot have that payment come out of your Social Security, which is different than your prescription drug premiums. It has to come out of you sending them a check, you having it come out of a checking account automatic. There's going to be some ways to pay that. But there's really some components to this. Your total cost for the year are going to be capped at no more than $2,000 for covered drugs. And you can pay your your cost of drugs over the year. Our concern is, lots of things. We sat in a meeting a few weeks ago with one of the pharmacists for a big insurance company. So this person was in charge of understanding this program. We had somebody in the room that was representing a national organization of insurance companies. And then we had about 10 agents and 7 or 8 bigwigs at an insurance company. And I can here to tell you that nobody understood this program the same. Not one of us. Everybody had a little bit different understanding. So it will be very confusing. So when you see us talk about this is the biggest changes that have ever happened in the last 15 years plus to Medicare, this is one of those main changes. It is going to be extremely confusing. Some people shouldn't be enrolling in that M3P program. It just doesn't make sense. Some people aren't going to qualify for some of those changes. It's just going to be, there's no polite word. It's going to be a cluster.
It's going to be a bit of a mess.
And you're going to have, I'm afraid of a few things. One of the things I'm afraid of is you're going to have some of these telemarketing organizations prey upon people and say, oh, you're not going to spend more than X, Y, Z. And oh, you can now finance your prescription costs every month. When you have somebody who's on a couple inexpensive drugs, they should not be looking at financing the cost of their drugs over the year. It doesn't make any sense.
Right. No, it can actually cost them more. I had the exact same thought. I'm glad you went there because I was going to say the exact same thing. It is going to be a bit of a mess for members, for the insurance companies to explain that clearly, and for pharmacies to understand what copays they collect and when and how, and if that smoothing has been implemented and whatnot. It's going to be an interesting year. Again, more reason than ever to have a broker that can help you navigate that.
Deductibles are going to go way up.
It's going to be interesting. Overall, the intent, from what we understand, is that your drug coverage, especially if you're on Eliquis and Xarelto and Ozempic, like more and more people are, that your costs overall will be better throughout the year. Lower overall expense, which is good. I am a realist, Casey. How is that paid for? Right?
Exactly.
What's going to be affected with that improvement in benefits and coverages on your prescription? So my guess, we've talked about this, my guess is that in the next year or two, we're going to see some ripple effects from this.
Oh, there's a hepatitis C drug that's $100,000 a month. Now, there's not very many people on it, but you kind of imagine if you have a county that has 5,000 or 6,000 people on a plan, and 1 or 2 of them are on a drug that's $100,000 a month. And now the insurance company is on the hook for even more of that cost than they were this year. Where do you think they're going to get that money from? They're going to reduce benefits. They're going to increase costs a lot of times. We've seen some of the plans, kind of a sneak peek. So there's nothing I'm going to give out because we don't know yet until after October 1st, nor can we talk about it. But we've seen drug deductibles go from $0 to potentially $400 or $500. So no deductible in 2024 and a $400 or $500 deductible in 2025 to try and eat up some of those costs. You're going to see probably those extra benefits degrade, go down in 2025 and 2026. Coincidentally, also, Medicare is giving a smaller amount of increase to the insurance companies per member per month in 2025 than they did in 2024. So now they have even less money to spend for the increased costs than what they assumed in the last few years. So it's a perfect storm of good intent, and I love that. I think there is a good intent there. We want our clients to spend less money. That's what keeps people happy, right? There's a good intent, but the ripple effect, the actual rubber that hits the road, I'm not sure it's going to be as good as what was intended. I know it's not going to be as good as what was intended.
There will be repercussions. We'll see premiums probably go up. Like I said, benefits degrade some. So again, work with a broker. It sounds like a broken record, but work with a broker that can give you the options year after year from multiple companies to really make things make sense for you based on the changes and what's going on.
Yeah.
So very, very important.
You see the government doing it. We also had that demonstration the government did. There's 10 drugs that they're starting to negotiate on Medicare, which is good. And they're going to expand that next year. What I get calls about that once. Well, the government's now negotiating for Medicare prescriptions. Well, they are, but keep in mind, those changes don't go into effect till 2026. So there's a lot of things happening in Medicare because how expensive it is for the federal budget.
Right.
And some of it's good. Some of it's great. Some of it we'll have to see.
Yeah. Interesting times, to say the least. As interesting as insurance can be, right? I mean, it's Medicare, folks. We're not taking this too seriously. We get it. But this has been fun.
Yeah.
As we continue to get more and more questions, people bring up more and more topics. We'll continue to address them as they come up. But we appreciate you spending some time with us. Hopefully this gave you some clarity on a few things. If we can help in any way, shape, or form, please reach out to us at any time. But for now, any final words?
Nope. Appreciate it.
Okay. Thanks, guys. Have a great day.